Welcome everyone. My name is Sean O'Hagerty from the University of Cambridge, and it's my pleasure to introduce you all to the AI and Pandemic Response Working Subgroup session. It's my privilege to introduce our two co-chairs, Alice Oh from the Republic of Korea, an associate professor of computer science at KAIST and an expert in machine learning and computational social science, and Paul Sutens, Professor Emeritus at KU Leuven and an expert in computer science and medical imaging. Paul, may I give you the floor to start us off?
Okay, thank you, Sean, for this introduction. Let me start with explaining how the subgroup has been composed. The subgroup was launched at the end of July and consists of 21 members for the moment. It can increase in the future. Most of them come from the technical world, such as computer science and engineering, and most use AI to address complex medical challenges, for example, medical imaging, bioinformatics, clinical risk prediction, or health delivery services. 6 out of the 21 currently are women, and 13 members come from the academic sector, while 3 work in the private sector, 1 for a non-profit, 3 in the public sector, right, and 1 in an international organization. Currently, there are 16 countries or international entities designated members, and these are in alphabetical order: Australia, Canada, the European Commission, France, Germany, India, Italy, Japan, Korea, Mexico, New Zealand, the OECD, Singapore, Slovenia, United Kingdom, and the USA. There are also 2 observers in our group for the moment.
Thank you so much, Paul. Alice, could I pass over to you to talk us through the working group's mandate and the process that has been followed within this working group over the last couple of months?
Yes, thank you, Sean, for the introduction, and thank you, Paul, for introducing the group. Let me now introduce our mandate. So, in light of the current international context, the GPAI task force has invited the Responsible AI Working Group to create an ad hoc AI and pandemic response working subgroup to foster and support the responsible development and use of AI-enabled solutions to address COVID-19 and other future pandemics. More concretely, the subgroup ensures that methods, algorithms, code, and validated data are shared rapidly, openly, securely, and in a rights and privacy preserving way in order to inform public health responses and help save lives. It will promote cross-sectoral and cross-border collaboration, as well as support engagement with the responsible use of AI among the public and healthcare professionals in the global response to pandemic and to public health challenges. And now let me introduce the process we have followed in the last couple of months. So, as Paul said, the subgroup was created in late July of this year. And our first task was to identify a project with 3 sub-parts. First is the catalog of existing AI tools, applications, and platforms in the context of COVID-19. Second, to evaluate, shortlist, and assess a representative list of relevant and feasible AI initiatives with great potential for current and future pandemics. And third, make recommendations for future projects. So we launched a public call for proposals in late September 2020 for this project to find a partner who would assist in this project. And we received 5 bids, and after 1 evaluation round, we selected the Future Society's proposal. And from then, the Future Society worked closely with the steering committee set up by the subgroup and had 5 meetings during October and November. And also, the the Future Society made presentations to the entire subgroup at 2 meetings, and also had one-on-one meetings with some of the members also in October and November. Back to you, Sean.
Thank you so much, Alice. At this point, I'd like to introduce Sasha Alanoka, Senior AI Policy Researcher with the Future Society. And Sasha, could you present to us the work that's been done by the Future Society in collaboration with the working group?
Yes, for sure. Hello, everyone, and many thanks, Sean. So maybe a quick word before introducing our work on the Future Society. For those of you who don't know us yet, we're a global think tank specialized in the ethics and governance of AI, and we had the pleasure to collaborate with this subgroup and the co-chairs to build the recommendation of this report. And so I will introduce to you the process. The first pillar was to get an understanding of the current landscape of AI initiatives to fight against COVID-19, but also relevant for future pandemics. And for that, we leveraged some previous work, which was done by the subgroup, a survey, which already had over 60 initiatives identified, initiated another survey, and also did additional desk research in order to have a representative list of promising initiatives from across the world, which are those 893 initiatives that you see now. They were clustered in 4 different categories with a very particular focus on the AI tools, applications, and platforms. And they were spanning across 3 domains: the biological, the clinical, and the societal. Then we built, in a very iterative process with a steering committee, a criteria assessment framework to be able to evaluate all of those initiatives and to filter the ones that we considered the most promising. And so to do so, we focus on 6 criteria, which is the relevance, availability, adoption, and feasibility, the diversity and inclusiveness, the credibility, the interoperability, and the potential for GPAI to make a significant difference. Based on those 6 criteria, we were then able, in 2 steps, to shortlist the initiatives that we considered the most promising. And so the first step was to shortlist some initiatives based on 2 criteria in a quantitative form. And for this, we also collaborated with some medical and technical experts. And this led to a second stage of the selection process, where this time we did some in-depth analysis quantitatively, where we analyzed all of the 36 initiatives based on 6 criteria. And for this, we conducted some research, some interviews with some project leads, with domain experts, with, of course, members of the working group. And this in-depth analysis gave us 4 common enabling factors, 3 common challenges, and the recommendations that will be presented shortly by our co-chairs. Maybe a couple words on the common enabling factors that we found across those shortlisted initiatives. The first one was their ability to operationalize open sciences. So it's quite unusual, actually, when you consider the sensitive nature of health data, to share it. And of course, there are some constraints, some regulation in place, but there was definitely some efforts to be able to safely, securely still share what was shareable to advance research, some AI models, for example, also. So this was one of the first enabling factor. Then a second one was the level of interdisciplinarity and cross-sectoral collaboration, where really we had some feedback loops between data scientists, biologists, virologists, but also, of course, entrepreneurs. And this was something, a level of cooperation which was fairly unprecedented. Then a third enabling factor was the initiative's ability to fast-track traditional processes, whether it was for to go through peer review processes, to gain funding, to gain access to retrain some algorithm. So this was a third enabling factor. And a fourth one is the relevance and transferability of the AI initiatives, so their capacity of being repurposed and reused in future pandemics. And very quickly, I would like to say a couple of words on the clustering process. So as mentioned, the 94 initiatives of the catalog were spanning across 3 domains: biological, clinical, and social. And so here, this clustering framework helped us map the clusters, but also subclusters, to both be able to map the initiatives of the catalog and the shortlisted one, but also to identify gaps, such as in clinical treatments, like also in epidemiology and public acceptance, and another gap also in decision making and operational management, such as resource allocation.
Thank you very much, Sasha, for this overview. At this point, I'd like to turn back to Paul, if I may. Paul, could you present to us the 4 main recommendations coming out of the work so far?
Yeah, okay. So from the study that TFS did, there were 4 main recommendations that came out. And actually, these recommendations were to resolve, so their aim was to resolve the common challenges that were detected by TFS in the catalog. And so it's not surprising that these recommendations will be very parallel to the challenges detected. The first main recommendation was and is to co-shape a global health data governance framework to help overcome ethical and legal barriers, and that should be done in collaboration with the Data Governance Working Group. The second one is giving support to a central portal to fast-track cross-sectoral and interdisciplinary research and have access to reliable data. And I know, and we know that there are many such portals and repositories today, but there is still no single entry point to pandemic-related information. The third recommendations is to address current gaps, such as social acceptability of AI initiatives and drug treatments, and technology in general. And the fourth one is to set up 1 or more task forces for immediate challenges. The population should be correctly informed about vaccines, know what fake news is, and in particular, also be well informed about AI technology. Now, the TFS submitted its report November 23rd, so it's very recently, and in the following 48 hours, the members of our working group assessed the importance of the recommendations of TSS together with their sub-recommendation, because each main recommendations had several sub-recommendations, altogether 21 in total. And we used a scale from 1 to 5, and 1 means strongly disapprove the recommendation, while 5 means strongly approve. And based on the input of the members, the subgroup will focus on 3 priorities, and these 3 priorities are exactly those recommendations with a very high score, with scores of 4 and 5 only. Now, to focus on these 3 specific recommendations that we will use for or to focus on in the next 3 to 6 months. The first one is to help overcome ethical and legal barriers, and the work group should collaborate with other working groups to facilitate the development of a global health data governance framework that will help foster the development of tools that utilize medical data and AI for drug discovery and clinical treatment. The second focus is that the work group will contribute to the adoption of application powered by AI, like contact tracing apps, by raising public awareness and supporting pedagogical efforts about the technical settings of the applications and the data governance framework. And the third one is that the working group will consider methods for providing direct support to initiatives that could bring more immediate pandemic relief. Yeah, back to you, Sean.
Thank you so much for this, Paul. Alice, I wonder if you could speak to the longer term plans of the working group going beyond the next 3 to 6 months.
Yes, we are trying to decide on our 2-year objectives, and these objectives will be determined in the coming weeks. But we have 2 things that have been decided or that are pretty certain. So first, the subgroup is going to plan to keep following a user-driven approach instead of technology-driven approach. That is, we will focus on the most urgent issues met by diverse stakeholders, including patients, clinicians, and policymakers, on how AI could help tackling these issues that we're facing with the pandemic. And second, the subgroup will keep paying attention to undertaking projects that will help get rid of the main hurdles that impede the development of or adoption of AI tools in the field of pandemic response. So Paul has already discussed these hurdles, but again, they are ethical and legal barriers to getting data and access to reliable data. And third, but not least, lack of public adoption and credibility of AI technologies.
Thank you so much, Alice. That brings our presentation to a close. I'd like to give my warm thanks again to all of our speakers, Alice O, Paul Sutens, and Sasha Alanoka. And I would strongly welcome any questions from our participants at this stage. Thank you very much.